just as Italy went down with it. Both suffered explosive outbreaks. But as infections and fatalities soared in Italy, South Korea suddenly began to turn the tide.
So I think we should be in very heightened alert and ready.
Professor Hun Sang-lee advises the government.
The government was able to make a very fast move to identify and isolate patients.
Early mass testing, he says, the secret weapon.
South Korea was able to provide this wide spread testing. In the earlier phase of the outbreak, testing is much more important. But later, maybe you just have to go into the mitigation measure.
South Korea had test kits in stock. When the virus hit, the response was immediate. Watch how COVID-19 spread in South Korea and Italy. By early March, South Korea had far more infections. Then look what happened. Today, Italy has 8 times as many infections. Deaths there stand at 7,500. South Korea's at 126.
One of the learned lessons that we can see from Korea is having the test available.
If test kits aren't widely available fast, precious time's lost. South Korea did not go into total lockdown. Its manufacturers went into overdrive, producing test kits straight away. Per capita testing is the highest in the world and mortality the lowest. Why? Because early detection minimizes spread and asymptomatic cases are caught. There's drive-through testing and booth testing, 600 centers nationwide, keeping people out of hospitals. Tests take minutes, results by SMS in hours.
Inside each booth, there's a UV lamp and negative pressure. It's disinfected and ventilated after each patient.
Diagnostic capability on this scale is South Korea's silver bullet, enabling forensic digital contact tracing. But aggressive tracing's intrusive. Laws enacted after the last respiratory epidemic, MERS, 6 years ago, enable the government to track an infected individual's digital footprints, mapping networks of transmission and closing them down.
I think it is a balancing act. Korean response was quite draconian if you compare it to the standards that you might think in UK. So, but it was not as drastic as what they have done in China. So I think you have to really see the balance between how we can sacrifice in terms of privacy, but also how we can really work for the common good of the public.
In Asia, there is just more acceptance of intrusive measures which in the liberal West might be deemed too stringent to stomach. It's a cultural thing, but in South Korea, it's also enshrined in law. Public health trumps privacy, which you surrender in return for greater protection from a killer virus. And this is a trade-off which most people support. Personal data harvested from debit cards and mobile phones being crunched by government apps which enable better, more detailed contact tracing, the creation of travel histories, and even alert users if they get too close to where an infected person's been. After SARS, then MERS, South Korea had a plan in place, as did Taiwan, Singapore and Hong Kong, which have also kept infection and fatality rates low. Unlike China's authoritarian response, these Asian democracies were transparent, and their citizens readily adopted corona courtesies and took limitations on liberty in a wartime like...
Are seen as a key indicator to how countries are dealing with remains very incomplete.
The virus that causes coronavirus disease is spreading in some of our communities. This disease, also known as COVID-19, is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes. These droplets can spread to the mouth, nose, or hands of people who are nearby or possibly be inhaled into the lungs. Take steps to lower your risk of getting sick. Here are some things you should do. Wash your hands often with soap and water for at least 20 seconds. You can also use hand sanitizer that contains at least 60% alcohol. Take extra measures to put distance between yourself and others. Avoid close contact with people who are sick. Stay home if you're sick, except to get medical care. If you have severe symptoms, please call 911. Cover coughs and sneezes with a tissue or the inside of your elbow. Only wear a face mask if you're sick and around other people, or if you need to take care of someone who is sick. Clean and disinfect frequently touched surfaces. Older adults and people who have severe chronic medical conditions like heart or lung disease or diabetes are at higher risk for more serious illness from COVID-19. This group should consult with their healthcare provider about additional steps to stay protected. For more information on COVID-19, please visit cdc.gov/COVID-19. Let's work together to protect ourselves, our families, and our communities.